Hi. Hello. Hi, Shraddha. Hi, Satvika. So the plan is to do a live today on acne with Girls Buzz India, but I think she's having some trouble joining because I don't see her. Let's just have a look. Yeah, so it doesn't seem like she's able to join. Ah, we have her.
Hello.
Hi, how are you?
I'm good. I'm good. So sorry for the inconvenience. I don't know what happened.
No, that's okay. That's okay.
So, how are you?
I'm great. How are you?
I'm good too. So, all right. So, let's quickly dive into the session. We have a bunch
Yes,
of
yes,
questions for you.
yes.
All
Great.
right. So, starting off first, could you please tell us something about yourself?
Okay. I am a dermatologist, cosmetologist, and hair transplant surgeon.
Okay.
Um, I have my own clinic, which is in GK1 New Delhi in South Delhi,
All
and
right.
it's called Soul Derma Clinic, and I love it, and it's been great. Yeah, so that's about it.
It's wonderful, wonderful. So, starting off with the most cliche and the most asked question, why do acne occur?
So great question. Sometimes I feel like as a dermatologist, this is so basic for, for any dermatologist,
Yeah.
but I think everyone at some point in their life has suffered from acne or maybe one pimple here and there. And it's very multifactorial. Like, it's not just one thing that causes acne.
Yeah.
So there's, especially when we're younger, we want to believe that it's just the oiliness of our face, or maybe the face is not clean. I
Yeah.
think anyone that's been like a teenager with oily skin has thought that, it's the oil that's causing my acne. But
Right.
it's actually, there are so many factors, and science keeps evolving also, right? New things keep getting discovered. Like there was a
Right.
time when it was very controversial about diet and acne, but that
Right.
too plays a role. So when I say multifactorial, we're talking about, your diet, your lifestyle, stress, hormones, just your skin quality, genetics, so many different things.
Right.
And of course, what you're doing to your skin, how you're taking care of it, and other things like what you're applying in your hair. So all of these play a role in acne and acne management.
All right. All right. Great. And are acne of different types? And if yes, then what are they?
Yeah, so acne, when we talk about acne vulgaris, which is like the common type of acne that we see,
Right.
this has grades, so it starts with even blackheads and whiteheads are actually grade one of acne. People don't know this. They think that, oh, I just have some blackheads or I just have some whiteheads. No, that's not true.
Right.
That's actually grade one of acne. Then after
All
that, you have, grade two, which is when you start seeing those red bumps or pustules. And then you have grade three, which is like bigger bumps. So you might have seen, if you're not someone with severe acne, you might have seen it,
Yeah.
where someone will have like, very like dense acne packed together. So
Right.
that would be grade three. And then there's grade four, where it's just very scary looking, very cystic, very pustular, very like big patches of acne. So there are different types of acne, and then you have like a whole other variety, which is like, cosmetic related or hair related or sun induced. And there are just so many different types of acne, which is like a whole different, I think, topic altogether.
Right. 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 But I guess
So yeah.
people basically understand that okay, acne is only of one type, and they treat it in that manner only.
Yeah, but no, actually, you should figure out why is the acne happening. Acne has many
Right.
causes. Like it's not just one. It could even be that everything's perfect, that your sebum production in your skin is under control. Everything is fine, but maybe you're putting some hair oil that is aggravating your acne. So this is again a common practice in India. People apply hair oil. They
Yeah.
apply it overnight and they sleep on it. So that oil is on their pillow, it's coming onto their face, and then they're just kind of like it just aggravates acne, or maybe they have acne prone skin and it's causing the acne.
All right. And how do we treat acne, and do home remedies really work?
Okay. So I
Yeah.
know I'm going to break so many hearts when I say that home remedies don't work. They
Okay.
might give you short-term results, but they will never give you long-term results because,
Right.
I have nothing against home remedies, but I feel number one, you don't really know what you're doing to your skin. You don't know,
Right.
one day you use vitamin C, and then the second day you use something else. And then, like maybe you're using some lemon juice
Yeah.
mixture, and then some other time you're using some tomato mixture or something like that. But you're
Yeah.
not consistent because you're not sure if it's going to work or not.
Right.
So I feel like consistency when it comes to acne is the most important thing. So, that consistency is key. That's so important because even when I prescribe medication, I mean, I always tell my patients that it will take time. It's not going to happen overnight. Your acne will improve, but give it like a month, 2 months. Acne also doesn't pop up overnight. It does occasionally, but usually
Yeah.
you'll start with one or two, then it gradually increases in amount and it gets worse.
Right.
So treatment takes time, and home remedies, you're not able to sustain them. And everyone is busy. So one day you do it, second day you don't, third day you do it, fourth day you don't.
Yeah.
So that's why I always say this in terms of any treatment, consistency is very important.
Right.
Also, it comes down to treating the cause. It's like if you're a diabetic and you keep eating
Yeah.
cupcakes, but you also take medicines, or it doesn't work that way. You have to do many things together. So even in acne, like your
Yeah.
diet plays a role, exercise plays a role, lifestyle plays a role, stress plays a role, hormones play a role. So like if you're kind of under a lot of stress, there can be again stimulation of your hormones, androgen synthesis, which again aggravates your acne. There's
Yeah.
more sebum production. Sebum is the oil in our skin. So all
Right.
of this together just, worsens your acne. So these are a few
All
things to
right.
keep in mind.
Okay. Okay. And as we see, like the markets are flooded with actives these days. So, what are some of the actives that can, do wonders in curing acne?
So I, like any other, skincare lover, I love active ingredients, but being someone suffering from acne prone skin myself, like
Yeah.
I think the more simple you keep it, the better it is. So
All
you
right.
shouldn't, like when it comes to acne as a doctor, as a dermatologist, my
Yeah.
main treatment is I'll put something orally, like one tablet or one capsule, depending on the severity of the acne. I will
Yeah.
put a spot treatment for the pimples, and then maybe later work on the marks and pigmentation left behind. My first motive is to treat the acne. It's not to give you that satisfaction of giving you a few steps in your routine.
Yeah.
Of course, if you're someone that comes to me and says, "Oh, doctor, I read," like I have so many patients that will be like, "Oh, doctor, I read about this new serum or that new serum," or like random serums that even like I'm like, "Okay, what?" But sometimes, just to make you happy, we can definitely add in some active ingredients and some serums that would kind of give you that feel good factor or brighten your face along with treating your acne. Like for example, in acne, to answer your question,
Yeah.
retinols are great,
All
because we
right.
use a lot of products which are in the same family, like adapalene and isotretinoin. These are all used to treat acne. So
Yeah.
retinols are great. The other ingredients like azelaic acid, it's very acne friendly. It helps mildly with reducing the acne. It helps with the redness associated with acne and the pigmentation. So it's kind of an all-rounder.
All right.
I've had great experience with niacinamide and acne as well. I don't have any complaints. I feel like people with acne prone skin do well with niacinamide as
Yeah.
well. Vitamin C is a tricky one because I've seen that it's the most commonly spoken about. So even someone who's not very educated about skincare, they tend to know about vitamin C because that was one
Right.
of the first serums to be marketed as well. So
Yeah.
azelaic acid and these serums have kind of come up later. So vitamin C I've seen can actually trigger acne or worsen acne at times. Sometimes it's related to the base it's in. So you might have, if you're fond of, serums and you've tried different brands and different products, you might
Yeah.
have seen that some vitamin C's are sticky.
Right. Yeah.
Yeah, so sometimes the base does not suit acne prone skin. So I like to kind of hold off on vitamin C serum when I'm treating acne.
All right, all right. And when is the time that we know that, okay, now we need to visit a doormat? Because it's a very important thing to do. And most people tend to forget it. Most people tend to, ignore their acne. They do not consider it to be as that severe. So when is the time that we know, okay, now we need to go and see a doormat?
So honestly, I'm loving like this kind of thing with social media and awareness when it comes to skincare.
Yeah,
So I have people coming in just saying that, okay, like, we've been reading so much about different products, but we wanted to speak to a doctor first, which is amazing.
yeah,
That's how it should be. Like you don't, I always encourage my patients and my clients, like you don't need 10 things in your routine. You
right.
can use one active ingredient along with your sunscreen and have happy, healthy looking skin. You don't have to use multiple products. So, you know, I think it's totally worth investing in just meeting someone once and figuring out what your routine should be. Also,
Yeah,
when it comes to treating acne, like I said, blackheads and whiteheads are also acne. So if you even have simple blackheads and whiteheads,
yeah,
consult someone. So there are ways to maintain your skin so that they don't get aggravated, or even say you want to go for like a monthly treatment. Like, I mean, in again, living in a country like India, there is this culture for facials and scrubs and things like that. So rather than investing in parlor facials or scrubs, like, or even homemade scrubs, you can just speak to someone. Maybe they'll be able to give you an active ingredient like adapalene or glycolic acid or salicylic acid that will be acne friendly. It'll help with the blackheads and whiteheads, but you'll also know how to use it. So not that you're
right.
self-medicating with it, because I get so many people that come and tell me like, doctor, I'm using salicylic acid and I'm using azelaic acid in the morning, and then I'm using my this sunscreen and my that sunscreen and my this toner. So sometimes it's more about the way you're using it, not
Right.
really about what you're using.
Definitely. And how do we prevent acne, and do lifestyle changes or changes in the diet really help?
200%, 200%. Like if you're someone who's regularly working out and you have a healthy diet, which means healthy doesn't, again, in India, I get this a lot from my patients that hum to ghar ka khana khate hain.
Yeah.
Like we eat home food. That doesn't mean it's healthy. Just because it's home food doesn't mean it's balanced and it's healthy. A
Okay.
balanced, healthy diet has a portion of protein, it has a portion of vegetables, it has a portion of carbohydrates, and you have
Right.
balanced fats, right? So, or like for example, maybe at times people think they're being healthy when they have like home meals, but at the end of the day, they have ice cream or they have chocolate because it's at home.
Yeah.
So that mentality has to be kind of changed. So definitely your lifestyle, your daily routine makes a huge difference. Small habits, like changing your pillow covers every second day,
Yeah.
not putting your phone screen on your face, not touching your face, not picking your acne, or not like even some people, like if you've had a long day, so many times you come home and you don't wash your face. Small
Yeah.
habits make all the difference. And like I said, I mean, it is an era of people working out. Fitness is so important these days. But then
Yeah.
even while working out, people are not taking care of their skin the right way. I see girls in the gym wearing like layers of makeup, which
Yeah.
even my skin, I'm a dermatologist, but even I know that my skin won't be able to sustain that. Like obviously with age and just proper care, I've been able to keep my acne under bay, but I know that like if I'm going to start wearing foundation and
Yeah.
concealer and layers to the gym, I will break out.
Right.
So it matters. Everything you do matters. If you're someone who's suffering from dandruff, you should treat that as well. If you have oily scalp, you should be, managing that as well. So everything you're doing, from taking care of your scalp, your skin, your daily exercise, your dietary factors. If you're someone suffering from PCOS, PCOS is also so common. So like,
Right.
if you feel other features like irregular periods, facial hair growth, growth around the nipples, weight gain, thinning of hair, then that's also a red flag. That something's not okay and hormonal fluctuation is happening, and we should check that too.
Right. And talking about PCOS, so my next question is that how the acne in PCOS is different from normal acne.
I won't say that acne in PCOS is different per se, but a lot of times in women,
Okay.
it's like a very, like after seeing so many patients, you start to kind of see trends. So I
Right.
always observe, like, and even in the books, you'll see the same thing that many times when there's hormonal acne, whether it's around your periods or whether it's PCOS related, you tend to
Right.
see it more along the jawline, the chin area, on the neck area. So these are, but then now it's actually very conflicting because we have mask acne coming up too. So the mask touches in the same areas.
Yeah.
So I'm just
Yeah.
generally seeing a lot of acne under the mask as well. But hormonal
Right.
acne, you'll tend to see that it gets aggravated around periods. Like it's very typical, patients will always say that, okay, around my period, I always break out. So it's important as a doctor to also counsel the patient. Like if you feel that you're fine all month, but just around your periods it happens, again, some things that are sometimes out of our hand too. You learn to manage that acne when it pops out.
Yeah.
So I think it's
All
also
right.
about management, it's about psychological counseling because acne is very bothersome.
Right. Right. Definitely. Definitely. All right. So again, a very debatable topic, but should people with acne wear heavy makeup or not?
I mean, it depends on what you define as heavy makeup. That's one. So I feel
All
like
right.
there's no harm in using makeup, but I think you should also like try to research what you're using, use non-comedogenic products, avoid
Yeah.
expired products, make sure your makeup brushes are clean. They're very small things that once again, like every little thing contributes to acne and can worsen acne. If I'm
Right.
very frank, from personal experience, makeup does not sit well for me. Doesn't matter how much I've researched makeup.
Yeah.
Again, living in a country like India where it's like summer all year round, it's so hot, it's so humid.
Yeah.
Makeup, it's not really the makeup that breaks me up, but it's like the makeup with the like humidity and that oiliness on my face, and then you start feeling dirty. And I realized that over time, makeup was not making me look better. It was just kind of making me look duller because I was getting oily as well.
Yeah.
So, like that combination just wasn't working for you. So I think it's a very personal choice. So when you're a teenager, you still kind of are confused about what's working, what's not, and what to do.
Yeah.
But as you grow older, you start to figure out like what is working for you as well. To some extent, I do feel like your own judgment does come into play. And I honestly, like, I absolutely love tinted sunscreen. Like, I even use it if I have to really go somewhere. Like, I had to go to a wedding. I used my
Yeah.
tinted sunscreen. I was so happy, like I got that tint as well. I had sunscreen on, so I just felt like,
Yeah.
okay, good. I'm not doing any damage to my skin. I'm not gonna feel like I'm gonna break out, and I'm not gonna feel like, oh my God, I wore makeup and 2 to 3 days later I'm kind of, suffering because of it.
Repeating it.
Yeah, exactly. Regretting it and just thinking, oh shit, why did I do that?
Yeah. Definitely. Definitely. So coming to the last question, some of your skincare tips to prevent acne.
My skincare tips to prevent acne. That's a good one. I would
Yeah.
say the first tip is make sure you're working out and having a healthy, balanced diet. That's basic.
Yeah.
Second tip is if you do have acne or you feel like, you have acne prone skin and other features of PCOS, or maybe not, get your
Yeah.
PCOS checked. For guys, you can get your insulin levels checked. Insulin resistance also plays a role in acne.
Right.
And if you, again, like to prevent it, if you feel you have oily, acne-prone skin or even dry skin with acne, you should at least consult a dermatologist to keep a regular, like just fix a routine.
Yeah.
Skin quality changes with time, and with seasons. Sometimes when it's humid, even people with dry skin start feeling a little greasy.
Right.
So that
Right.
that does happen. So, and if you're someone with acne-prone skin or oily skin, make sure you do moisturize it and always pick non-comedogenic products.
Yeah.
So the best way to prevent acne is keep it simple, keep it minimal, use non-comedogenic moisturizers, gel-based moisturizers, and products in general.
All right. All right. Perfect. So yeah, as we're done with the questions, is there anyone asking any questions in the audience?
I did see a question or two, but I think I've lost them.
Um, all right. I think we pretty much covered a lot of points.
Yeah,
All right. All
great.
right. Thank you so much for doing this with us. Thank you so much for taking out your
Thank
time.
you. Thank you so
Thank you.
much. Take care. Bye
All
bye.
right. Bye. Have a nice day.
You too.